Telkom Business, behind South African businesses' drive to thrive.
Welcome to the Entrepreneurial SME with me, Rams Mabote. We are back with more small business content. This time around, we're placing the limelight on the healthcare industry. We look at how small business owners are going the extra mile in improving their business model and overall customer care. Joining me to talk about this is CEO and co-founder of Eagle Intelligent Health app, Arvind Raichur. But before we get into our chat, let's look at what this app is all about and how it assists South Africa's medical practitioners.
I'm Dr. Zahir Kadir. I'm a GP in Johannesburg. I'm also the medical director for MediBuddy, and we currently have a health app called Eagle Intelligent Health, which we are now launching in South Africa. It's originally from the United States of America. Our partners there have done very well, and we have now got the agency for the whole of Africa. I have been working in the medical aid and health insurance space for the last 10 years, and with the onset of COVID, we wanted to find a solution that allows people to be within their safe space, their homes, workspace, etc., and be able to reach out to a doctor or a health professional and get advice or get a consult. And there wasn't anything that had been properly developed in the market, and we looked for the best solution. And we got in contact with Arvind and Becky in the USA and saw that their application had done amazingly well, especially for what we wanted to do in the African health space. The idea behind the app is to give people access to telemedicine consultations and allow them to build an electronic health record on their phone. The unique part about our app is that every person gets to build their medical history, and it's stored in the cloud. So wherever they go, whoever they consult with, or if their loved one is concerned about them, we've got a fully POPI compliant application that keeps their medical records and history, tests, x-rays, CT scans. The app has definitely made the workflows much easier. It's allowed me to connect with a larger dynamic of patients. It's also allowed me to understand a patient that's coming in for the first time because they fill in an intake form and we have their full history, which speeds up a consultation, number one. And number two, allows me to perfect the diagnosis. Because remember, 80% of a diagnosis is made on the history taken before the examination.
Hello, Arvind, and thank you very much for joining us. Now, Dr. Zahir explains how the app works, but what I'm interested in is what inspired the app. You as based, and you did this thing and you brought it here. What inspired it?
You know, that's a really interesting question, Rams. I think the key to it is I've been in the health tech business now for about 4 years with this app, and the original inspiration was being a caregiver for my mother. So I think as a human being, and we go through the cycle of life, right? We're born, we need a caregiver, we grow up, we become, caregivers for our own children, and ultimately we become caregivers again for our parents. And I think anyone that has experienced taking care of a loved one, who's a senior and going through lots of doctor's appointments as their life is changing, you start to really understand the value of understanding their medical records. So here in the US, for me, my mom at the end of her life, and she's passed now, was seeing about 8 doctors for various conditions. And because of that, her health records were voluminous. Those records, trying to move that information back and forth between specialist to specialist is very difficult, even here in the US. What we built with the app was a way for the patients to be empowered to see their medical records across every physician or visit or hospital instance that they had ever had, and understand all of those medications. So the idea was to empower the patients to actually understand and take charge of their health care and allow them to invite in their caregivers to make sure that they receive the best care possible.
Sounds exceptionally brilliant, but does that need legislation, or is it a volunteer thing where if I'm a healthcare practitioner, I then choose to use the app to put the information of my patient in there? Because I'm thinking if it's not legislated, somebody may say, well, I don't have to put that information in there.
It's a great question, Rams. And fortunately, you're on the exact right track. Look, we built the technology in advance of it, Rams. But what truly happened is the U.S. did pass legislation that said that every patient in the United States is entitled to an electronic copy of their health records through the third-party application of their choice. We had already designed the technology, built the technology, started the service, and then when the legislation happened, of course, it opened the floodgates so that now every patient in the U.S. has the right to come and get their medical records from each and every provider.
Yeah.
Obviously, taking this application and making it very personal and poignant in South Africa required some changes. But the key point of it is the same. The design of the app is patient first. The design of the app is empowering the patient to understand their health history, their medical records, their medications, so that they can be in charge of their health journey. And that's really key.
Was partnering with Medibody here in South Africa helpful in bridging that gap where I don't think we have legislation? So did it help you?
Yeah, no, absolutely. And I think that what we've done that's really special with our relationship with Medibody is this idea that, we built the app designed for the patient, but then we presented that to Medibody and Dr. Zahir. As you're talking to him, you understand his excitement with respect to, wait a minute, I can take the records that I normally might even give in a written form to the patient afterwards, have those electronics so that the patient can see them, they can further understand them, and which only makes the healthcare journey better. But he can then see all those medical records from that visit or any other. So it makes diagnosis so much faster. It makes him better able to serve the needs of the patient. So it's really tied up in making sure that everyone has a full and complete view as best as possible of the patient.
Does it save me money as a patient? And I'll tell you what I mean. This is the bane of my existence. I would move from one doctor to another or a specialist because I'm not happy or for whatever reason. And I don't have my records, so I have to start from scratch. And I tend to be charged the first consultation fee to start the process that already exists elsewhere.
Yes, you've hit the nail on the head. Rams. The key is you walk into the doctor and you basically present him, which is on your phone already, an electronic copy. Here's everything I've been diagnosed with. Here's my health history. Here's the medications I'm taking. Here's the tests I've had, even the lab work, so you don't have to repeat it. You don't have to send me back. I'm coming with all of that. So it saves you time. It saves you money. It expedites the process so that you can get the healthcare faster.
A huge market the US is. One would wonder, why come out here? Running away from competition or expanding your markets?
It's really a different opportunity, Rams. I mean, in the US, I'm very happy with our progress here, but the opportunity in South Africa is very, it makes you feel good, right? We're empowering people that have not had the same opportunity to access for healthcare, through this app. And we're educating the patient on the entire, healthcare process and what those records mean. Because if you just give the patient the answer and don't actually educate them on what's happening with their health and how they can have a better wellness journey, you haven't fully given them all the tools that are necessary to live the best life. What the app also does, and I think Dr. Zahir may have shared that in his portion, but it literally curates out for the patient their own personal health search engine based on their own medical records, so that now, as they are looking at their medical records, they can simultaneously have research on their conditions and their medications. And that really helps. And it helps their caregivers as well.
We're going to take a break from our conversation with Arvind Raichur. And when we come back, we talk more about his particular business.